Mansfield today, nice to have you along with us once again on this Wednesday when we talk matters medical with our resident Dr. Vicky Skitter. Hello, Doctor.
Hello, Jeremy.
Nice to see you again. When I was talking yesterday to Samantha, our producer, Samantha Khan, I said, Sam, what are Vicky and I doing tomorrow? Because if you don't know, what happens is that Sam, who's our executive producer, would get hold of Vicky and they would work out more or less what we're going to do. And then Vicky goes off and does the research around it. And then Sam tells me what we're going to do. So she said to me yesterday, Vicky's doing a show on you tomorrow. And I said, what do you mean she's doing a show on me? And she said, she's doing irritable bowel syndrome. And the first thing I thought of was you.
Oh my gosh, shame.
Yeah. What is irritable bowel syndrome?
Okay, so irritable bowel syndrome is a common ailment or illness that involves the large intestine. So it's also a chronic illness, so it's usually a long-term treatment, and the symptoms are normally abdominal cramps, bloating, gassiness, sometimes diarrhea, and constipation. And a small group of people have severe symptoms, so most people can control their symptoms with diet, lifestyle, and exercise. And it's also important to know that IBS is not a disease that changes the tissue of the bowel, like the inflammatory bowel diseases. So it's not a risk factor for bowel cancer.
Okay, so it's not something like Crohn's disease or something like that, which would become a risk factor.
No.
Okay, is it very common? Do you
It's
find
very common, especially
Really?
in females, yeah.
Really?
Yeah, we're full of...
Yeah, okay, you don't even have to go there because I know you won't. But then what causes it?
So we don't really know what the causes are. There are some factors that play a role, like the muscle contractions in the bowel. The lining of the bowel is like muscles, just muscles to move the food and stuff through the digestive tract. And those muscles, when you get stronger, longer contractions, it can cause bloatedness and pain and diarrhea. And if you have weaker, shorter contractions, it can cause constipation because the food moves slower. But then there's also a theory that there's a bit of neurological malfunction, so there's a problem with the signals between the brain and the gut. So some people would get more than normal discomfort during, when the bowel distends, if it's moving the stool or the food along. Then there are severe infections that can cause it. So if you have gastro, viral or bacterial infections can cause a disturbance in the microbiome. So there's bacterial overgrowth and that doesn't function well. Or early life stress, especially in childhood. Kids that's been exposed to stressful situations often can develop IBS.
That's interesting. So it also can be stress related.
Stress definitely makes it worse. And then you get food triggers as well, like food. It's not food allergies, but food intolerance, like common with wheat, dairy, citrus, beans, cabbage, carbonated drinks. And then the risk factors would then be females, like I said, under the age of 50 usually. People that suffers from depression and anxiety or other mental issues like physical abuse or mental abuse, and a family history. Family history is important.
So, but then that must be very difficult to diagnose it or to test for it, because it's not as though you can say, okay, well, let's take a blood test, and then you turn around and say, right, you've got irritable bowel syndrome.
It's a tricky one, because the main thing is basically to exclude other causes. So you'll obviously do a proper examination and history, but the main thing is to exclude sinister things or more serious diseases. And the red flags there, for example, would be if IBS or symptoms of IBS starts after the age of 50, if you've got weight loss, maybe blood in the stool, iron deficiency, and also pain, discomfort, or diarrhea while you're sleeping. Those are the things. So you can there are certain tests you can do, like lactose intolerance or food intolerance test. You can do a breath test that will tell you about bacterial overgrowth. Then you can check the stool for infections, blood, bile acids, and then obviously the normal gastroscopy, colonoscopy, X-ray, CT scans, and it's basically just to exclude the dangerous things, or the inflammatory bowel disease or something like that.
Yeah.
And then if that's all negative, then it probably is IBS.
Yeah. Okay, you've excluded all of the inflammatory ones, and you've now established that I have irritable bowel syndrome.
Yes.
What is the treatment for it? Because that must be equally as difficult as actually trying to find out what it is.
Yeah.
You know what I mean?
I find it sometimes a bit wishy-washy, but obviously there's certain things you can do. So you can definitely avoid the triggers. If you know what the triggers are, you're definitely going to avoid them. Then you can increase your fiber intake. You can make sure you drink enough water. You can exercise. You can make sure you sleep properly. So those are the basic ones. And then the medication you can use is like laxative or antidiarrheals, obviously fiber supplements, antispasmodics, antidepressants. Sometimes certain ones you can treat with. And then if those don't work, there's certain painkillers as well. They're more central acting painkillers like Lyrica. I don't know if you've heard about that, or Neurontin. But then if that doesn't work, it's time to visit your gastroenterologist. Sometimes people need counseling, but there's a interesting treatment in the pipeline, pun intended.
I was going to say yesterday.
It's called FMT. I think you're going to find this interesting. So it's fecal microbiota transplant. So it's a a poop transplant. So you take individual's healthy processed stool and you transplant it into the other person. So you can either use a nasogastric tube, which I find disturbing, or you can use enema. It's also a bit disturbing, or colonoscopy. But then, Jeremy, for you, there are poop pills.
No.
It's capsules. It's called crapsules.
Vicky.
It really is. They call it crapsules. And those are filled with freeze-dried poo. And you swallow them. I know it's quite interesting. And there's even they're doing studies on these crapsules. Can't help saying this, is so funny. That it might help in other chronic diseases like asthma, imagine that, arthritis, Crohn's disease, chronic fatigue, eczema, insulin-resistant mood disorders, Parkinson's, and so what do you have to say to that?
I just can't picture it. You're sitting with a bunch of mates and you say, ooh, ek moet my kak drink.
Yep.
At first I thought you were pretty well.
No, someone else's, not your own. Iemand anders.
Oh, yeah. Okay.
So,
Dr. Vicky, I don't know if I should be saying thank you, but thank you for the laugh.
it's a pleasure. A serious laugh.
Yeah, a serious laugh. We have to laugh at some of the serious stuff every now and again. That's it for today. That's all I can take for today. And eat it and geniet it. Until next time, bye-bye.